We discussed the role of ultrasound in managing gallbladder stones. Let's discuss what gallbladder stones are. These are just solidified bile or solidified digestive juice that hardens and forms lesions, or it forms pellets in the gallbladder. And what are some of the signs and symptoms that you might be having to think that you have gallbladder stones? One could be epigastric pain. It could be pain in the right hypochondriac region. It could be pain radiating to the back. It could be a generalized abdominal pain. You could have vomiting. You could have jaundice, just that is yellowing of the eyes, yellowing of the skin, and yellowing of the urine. You could have just even fever, depending on how bad the effect that the stones are causing. So once you have these symptoms, you'll go to the hospital to see what exactly the problem is, and you'll be told to do a scan. One will do a scan called abdominal scan, or sometimes it will be so specific, we just go ahead and do a hepatobiliary scan. And what is a hepatobiliary scan? We just want to look at the liver and the biliary tree to make sure that those structures, the liver, the gallbladder, the pancreas, with the biliary radicals, are normal. So what do we see if there's a gallstones? We'll see echogenic lesions. We'll see echogenic solid structures in the gallbladder. These echogenic structures could be causing shadowing, or it might not be causing shadowing, depending on the components that are in the stones. Now, again, what we want to look at, we want to see how many stones are there. Is it one? Is it two? Are they multiple? We also want to look at the wall of the gallbladder. Is it thickened or not? Because sometimes if you have gallstones, it will form inflammation of the gallbladder wall, what we call cholecystitis. Also, we want to discuss this. We want to report this when you are reporting a report to the team of the clinicians who are looking at you at the clinic. We also want to make sure that these gallstones are not causing obstruction to the outflow of the bile from the gallbladder. So we want to look at the gallbladder to make sure that it's not dilated. Again, we want to look at the gallbladder just to make sure there's no other mass, because unfortunately 1 to 3% have practiced ultrasound in the last 15 years, and unfortunately the unfortunate thing is 1 to 2% of the patients that I've seen with gallbladder stones, most of them turn out to have cancer of the gallbladder. So that's the reason why when you're having some of these symptoms, when you're having some of these pains, kindly go to the hospital. And even when we do a scan and we find out that there are gallstones, kindly seek medication, because sometimes we just medical practitioners, and sometimes you might not know exactly what you're dealing with. So that is what I wanted to discuss to you this time. And I believe that information has been helpful to someone. Once you have these issues or pain, just go to the hospital and do this examination. Ultrasound is a simple procedure with no radiation. And I believe once a problem is found, a solution is going to be administered. Thank you very much. I've always prayed for you. I've always said that may God keep us. And even as we share the information, my issue has always been, my prayer has always been that this information is going to help someone. Thank you, and have a great day.